Hello, my name is Dr. Linda Isaacs. The material in this video is designed to augment what's available on my website, so please visit that site to learn more about what it is that I do. My website address is www.drlindai.com. Again, www.drlindai.com. A question that people commonly ask is, what are our statistics for various types of illnesses? They've gone to see an oncologist. The oncologist has given them statistics, success rates for different types of treatment, and they want to get the same kind of answer from us. But what patients don't always realize is that the statistics they were quoted don't come from the oncologist's own practice. They come from big research studies. And those studies are designed to help give more definitive answers by minimizing some of the variables that can help affect how well someone will do. As an example, there's overall health. You wouldn't expect a treatment to work as well in somebody that's got a lot of health problems as opposed to somebody who's perfectly healthy aside from their cancer. So that's one of the variables that a big study would typically control for. Another would be, how much treatment have they previously had? For example, if someone has already had 3 different treatments that didn't work for them, you wouldn't expect that 4th treatment to work as well as it might work for somebody else that it's the first thing that they tried. Another consideration is that sometimes it takes an enormous number of patients to get any kind of meaningful information. As an example, common question. A woman has had breast cancer. She's had surgery, she had the lump removed from her breast, and she had some lymph nodes removed. Some of those lymph nodes were positive. She goes to the oncologist, is given some information, comes to us, and wants to know what kind of results we would get. The trouble is that the data the oncologist gave her is based on studies that involve thousands and thousands of women. The reason is that in that type of setting, typically some patients with positive lymph nodes in breast cancer might actually have done perfectly fine without getting the chemotherapy at all. And some of them are going to have a recurrence anyway. So if you treat 100 women, there's probably only a few that will benefit. To demonstrate that kind of information, you need huge studies. No private practice is going to be able to generate that kind of data. But then with our particular patients, there's one other big variable, and that is, do patients actually do what we ask them to do? This program involves modifying the diet. It involves taking a lot of supplements, as many as 150, 200 pills a day, and it involves doing detoxification routines such as coffee enemas. All of those things take time, they take energy, and not everybody follows through. I wish I could say that I'm such a persuasive doctor that all of my patients do what I tell them, but that's not the case. That's not real life. And so the net result is that we don't believe that we can really generate effective data for the kind of statistical questions that people ask us. What we have available are case reports. Case reports are descriptions of patients from our practice that have done extremely well with illnesses that should have taken their life or impacted their life, and they're continuing to do well. All of those things can be found on our website, on my website. There are articles that were written about case reports. There are the books that Dr. Gonzalez had written, and there's the book Dr. Gonzalez wrote about Dr. Kelly's practice. All of those show what the method can do. Of course, I can't guarantee that any individual patient will get those results, but it will give you an idea of what can be possible with this treatment. I'd also recommend that you read the article that Dr. Gonzalez wrote on this topic about statistics, because it adds a lot more information to what I've said here.